Here is something that most adults over 60 have never been told directly. Dementia incidence does not plateau with age. It does not level off at 70, or 75, or 80, according to a landmark study published in JAMA Neurology, tracking 3,602 adults aged 65 and older. Dementia risk roughly doubles every 5 years between the ages of 65 and 90. Every 5 years without stopping. And here is what makes that number matter right now. The earliest biological changes that lead to dementia, the amyloid accumulation, the synaptic disconnection, the vascular damage building quietly in the brain's memory center, can begin a decade or more before any diagnosis is made, which means the window to act is not after the diagnosis, it is now. In the signs that most seniors and most doctors are currently dismissing as normal aging. If you are over 60, this video is going to show you 7 specific early signs that the research now identifies as meaningful neurological signals, not normal forgetfulness, not stress, not just getting older, and more importantly, I am going to show you what is actually happening in the brain when each one appears, and what you can do about it before the window closes. Because by the time memory loss becomes obvious, some of the most important opportunities to protect your independence may already have passed. Now, I want to acknowledge something before we go any further. If you have been doing crossword puzzles, word games, brain training apps, because someone told you that staying mentally active was the way to prevent dementia, you are not wrong to try. That advice came from a good place. But here is what the research has since clarified, and what the 15-minute appointment rarely has time to explain. Cognitive exercises alone do not adequately address the primary biological drivers of early dementia: amyloid accumulation, vascular damage from uncontrolled blood pressure, insulin resistance in the brain, sleep-disrupted clearance of metabolic waste, chronic neuroinflammation. These are the upstream mechanisms, and no amount of Sudoku reaches them. Researchers at Massachusetts General Hospital, publishing in the journal Brain, identified that the earliest Alzheimer's pathological changes begin in the medial temporal lobe, in the hippocampus and entorhinal cortex, years, sometimes decades, before a formal diagnosis. During that entire window, the standard recommendation has been to stay mentally active and come back if things get worse. That is the gap, and that is exactly what today is for. Now, before I walk you through all 7 signs, I want to flag one specifically. Sign number 5. It is the one that gets dismissed most reliably, by families, by physicians, and by seniors themselves. It is often attributed to retirement adjustment, or low mood, or just slowing down, but according to Mayo Clinic diagnostic criteria for early Alzheimer's, it is one of the earliest and most consistent biological signals that something has already shifted in the brain's neurotransmitter systems. I will get to it. Stay with me through each sign in sequence, because the order matters. But first, drop your age and the city you are watching from in the comments right now. We read every single one. You are part of a community that is choosing to act while the window is still open. Let me walk you through all 7 signs now, and for each one, I am going to show you the biology behind it, so you understand not just what to notice, but why it matters. Sign 1, repeating the same question or story within minutes. Not repeating a story once a week because you forgot you told it. Repeating the same question or the same story within the same conversation, sometimes within the same hour, with no awareness that it has already been asked or said. What is happening in the brain during that time? The hippocampus, the memory center, is responsible for encoding new episodic memories. When amyloid beta oligomers begin accumulating at hippocampal synapses, they bind to NMDA receptors and impair long-term potentiation, the biological process by which a new experience becomes a retrievable memory. Think of it as a recording system where the write function has started to fail. The playback still works for old memories, but new information is not being saved. What to notice then is the repetition specific to recent information, conversations from today or yesterday, while older memories remain vivid and detailed. That pattern, recent memory failing while older memory holds, is the hippocampal fingerprint of early Alzheimer's pathology. Sign 2, getting disoriented on a familiar route. Not getting lost in a new city, getting confused on a route walked or driven 100 times. Turning the wrong way out of a familiar parking lot, momentarily losing orientation on a street walked every morning for years. What is happening in the brain, the entorhinal cortex, which sits adjacent to the hippocampus and acts as your brain's internal GPS, is among the first regions affected by tau protein tangles in early Alzheimer's progression, as tau hyperphosphorylation destabilizes the microtubule structure of entorhinal neurons. Spatial navigation and route memory begin to falter. The map still exists, but the GPS is losing signal. What to notice then? Does the disorientation resolve quickly with a landmark cue? Or does it take longer than expected to reorient? Prolonged spatial confusion on familiar terrain is more significant than a brief moment of hesitation. Sign 3. Word-finding pauses that are getting more frequent. Everyone occasionally loses a word mid-sentence, but when the pauses are becoming more frequent, when the word feels just out of reach and the sentence hangs while the brain searches, this is a specific and meaningful early signal. What is happening in the brain is language retrieval depends heavily on cholinergic neurotransmission, the acetylcholine system that runs from the basal forebrain through the cortical language networks. Early degeneration of basal forebrain cholinergic neurons, one of the most consistent findings in early Alzheimer's, reduces the speed and reliability of semantic and phonological retrieval. The word is in storage, the retrieval pathway is becoming less efficient. What to notice, then, is the word-finding difficulty specific to proper nouns and names, which are most vulnerable to early cholinergic decline. Or is it spreading to common everyday words? The progression from names to common words is a meaningful directional signal. Sign 4. Difficulty managing medications, bills, or familiar tasks. Not finding a new financial task confusing, finding the monthly bill payment, the medication schedule, the recipe followed for 30 years, suddenly harder to sequence correctly. Steps get skipped. The order feels uncertain, mistakes appear where there were none before. What is happening in the brain is executive function and task sequencing are governed by the frontal association networks, which connect to the hippocampus and posterior cortical regions through long white matter tracts. As amyloid accumulation and small vessel disease begin disrupting these connections, the ability to hold a multi-step plan in working memory while executing it starts to erode. Think of it as a construction project where the blueprint keeps disappearing mid-build. What to notice, then, is the difficulty in tasks that require holding multiple steps in mind simultaneously, while single-step tasks remain intact. That dissociation between complex and simple task performance is diagnostically meaningful. Sign 5. Apathy, withdrawal, and loss of initiative. This is the sign that gets missed most often, and it is the one I flagged earlier as the most important, so please pay great attention here. The senior who used to initiate social plans, who used to suggest the restaurant or the outing or the phone call, gradually stops initiating. Not because they are depressed in the way most people recognize depression, but because the motivation to engage simply quiets. They still enjoy things when they happen, but the internal drive to make them happen fades. What is happening in the brain is apathy in early dementia is driven by degeneration of the monoaminergic systems, particularly serotonin and dopamine pathways that run from subcortical structures through the anterior cingulate cortex and frontal lobes. These are the systems that generate motivational drive and reward anticipation. When they are disrupted, the result is not sadness. It is a reduction in the biological signal that says initiate. The desire is not gone. The neurological spark that converts desire into action is dimming. What to notice, then, is the withdrawal new and out of character. Has it appeared gradually over months rather than in response to a specific life event? Apathy that cannot be explained by grief, illness, or circumstance, and that represents a change from the person's baseline personality, is one of the earliest and most reliable behavioral markers of neurodegenerative change. Sign 6. Poor judgment in familiar situations. Not making a bad decision under pressure. Making decisions that feel obviously wrong in situations the person has navigated successfully for decades. Giving money to a caller who would previously have been immediately recognized as suspicious. Leaving the stove on in a way that never happened before, making safety errors in familiar domestic routines. What is happening in the brain is judgment requires the integration of past experience, risk assessment, and inhibitory control, all functions of the prefrontal cortex and its connections to the limbic system, as prefrontal networks disconnect from hippocampal memory and amygdala-based risk signaling. The ability to apply experience to novel situations in real time deteriorates. The knowledge is still there. The real-time application of it is becoming unreliable. What to notice, then, is the poor judgment occurring in domains where this person has always been competent and cautious. Financial vulnerability and domestic safety errors in previously careful individuals are high-priority signals. Sign 7, sleep disturbance and unusually vivid dreams. Waking frequently during the night, difficulty returning to sleep, vivid, sometimes disturbing dreams that feel more intense than they ever did before, or conversely, sleeping far more than usual and still feeling unrefreshed. What is happening in the brain, then, is during deep slow-wave sleep, the brain activates the glymphatic system, essentially the brain's overnight cleaning crew. Cerebrospinal fluid flows through channels around brain cells, flushing out metabolic waste products, including amyloid beta, when sleep architecture is disrupted. This clearance system fails to complete its nightly cycle. Amyloid accumulates faster, and early Alzheimer's pathology itself disrupts the sleep-wake regulation centers, creating a reinforcing cycle where more amyloid means worse sleep, and worse sleep means more amyloid. What to notice, then, is the sleep disturbance new, and is it accompanied by any of the other 6 signs described today? Sleep disruption in isolation may have many causes, but appearing alongside memory lapses, apathy, or word-finding difficulty carries a different weight entirely. Let us understand it in detail through Dorothy, who experienced this situation. Dorothy is 74 years old, retired librarian, precise, well-read, the kind of person who has always noticed details others missed. Her family noticed sign 5 first, the apathy. Dorothy had always been the one to organize the family dinners, to suggest the Sunday calls, to remember the birthdays without being reminded. Gradually, quietly, over about 8 months, she stopped initiating. She was pleasant when the family reached out, but she no longer reached out herself. Her family assumed it was the adjustment to retirement. Her physician, at a routine checkup, found nothing alarming in her standard cognitive screening score. Dorothy's daughter, a registered nurse, recognized the pattern for what it was, not depression, not adjustment, a behavioral signal that warranted a fuller evaluation, and a change in the biological environment the brain was living in. Dorothy was skeptical, the way someone who feels mostly fine tends to be skeptical of urgency. She said she was just taking things slower. Her daughter gently said that taking things slower was fine, but changing what she fed her brain and how she slept was not optional. 18 months into what her daughter called the Independence Protection Protocol, Dorothy's neurologist noted at her follow-up that her rate of progression on cognitive measures was slower than the typical trajectory for someone with her early-stage presentation. Dorothy's daughter put it simply, "We did not reverse anything, we bought time, and time, at this stage, is everything." This is called the Independence Protection Protocol. 5 steps, all of them natural, none of them requiring a prescription or a specialist referral to begin. Total additional cost, under $3 a month. Step 1, the olive oil daily habit. Every day, with your main meal, use 1 tablespoon of extra virgin olive oil, drizzled over cooked vegetables, stirred into beans, used as a salad dressing base, not cooking oil at high heat, drizzled raw or at low heat to preserve the polyphenol content. Extra virgin olive oil is the most studied single dietary component in Mediterranean diet research on cognitive outcomes. Its polyphenols, particularly olecanthal, inhibit the same COX-2 inflammatory pathway that drives neuroinflammation, and its monounsaturated fat content supports the vascular health that protects the brain's blood supply. A 1-liter bottle at most U.S. grocery stores costs under $3 and provides more than 60 daily servings. That is under 5 cents per day. This is not a supplement. It is a daily habit that costs less than a single stick of gum. Step 2, the sleep architecture reset. The glymphatic system, your brain's overnight cleaning crew, operates primarily during deep, slow-wave sleep, and it requires 2 conditions to function properly: consistent timing and sufficient duration. Starting tonight, set a fixed sleep time and a fixed wake time, the same time every day including weekends, not because duration alone matters, but because circadian rhythm consistency is what governs the depth of slow-wave sleep, and slow-wave sleep is when amyloid clearance happens. If you wake during the night, do not reach for your phone. The blue light suppresses melatonin and pulls you back toward light sleep. away from the slow wave stages where the cleaning crew does its work. Keep the room dark and keep the temperature slightly cool. Give the system the conditions it needs. This costs nothing, and it may be the single highest leverage habit in this entire protocol. Step 3, the 20-minute walk. Aerobic movement is the most consistently evidence-supported behavioral intervention for reducing dementia risk, and the mechanism is direct. Regular walking improves cerebral blood flow, reduces insulin resistance in the brain, lowers systemic inflammatory markers, and supports the vascular integrity of the small vessels that supply the hippocampus and frontal cortex. These are the same vascular and metabolic pathways that, when damaged, accelerate the progression from early signs to functional loss. 20 minutes, most days, brisk enough to feel slightly warm. This does not need to be continuous. 2 10-minute walks produce the same cumulative vascular benefit. The post-breakfast window is particularly effective because movement at that time directly blunts the insulin spike that drives neuroinflammation. Step 4, the blood pressure audit question. At your next appointment, ask your physician this specific question. Given that I am over 65, what is the optimal systolic blood pressure target for protecting my brain, and are we currently hitting it? This matters because the standard blood pressure targets used in general medicine are not always calibrated for the cerebrovascular vulnerability of adults over 65. Uncontrolled hypertension, even in the range that gets described as acceptable, is one of the most powerful modifiable drivers of small vessel disease in the brain. The vascular mechanism behind signs 2, 4, and 6 on today's list. You are not challenging your physician. You are asking a precise question that opens a conversation your brain needs you to have. Step 5, the social engagement anchor. Social isolation is now recognized by researchers as a dementia risk factor comparable in magnitude to hypertension and physical inactivity, not because loneliness is depressing, but because genuine social interaction, conversation that requires real-time language processing, facial recognition, emotional attunement, and memory retrieval, provides the kind of complex cognitive demand that builds and maintains neural network resilience. One real social interaction daily, a phone call, a visit, a conversation with a neighbor that goes beyond pleasantries, not passive consumption of television or social media. Active, reciprocal, human engagement. This is not optional decoration, it is neurology. Who should seek immediate medical evaluation? Before continuing with any self-directed protocol, please speak with your physician urgently if you or someone you love is experiencing any of the following. These go beyond early signs and require clinical assessment now. Sudden onset confusion or delirium that developed over hours or days, with fluctuating alertness and disorganized thinking. A new focal neurological sign. Sudden weakness or numbness on one side of the body. Facial droop, slurred speech, or sudden visual loss. Rapidly progressive cognitive decline over weeks rather than months. A new unprovoked seizure in an older adult. Major personality change with safety implications. Wandering. Financial vulnerability, aggression, or disinhibition that appeared suddenly, inability to manage basic daily activities after a previously stable period, new hallucinations, or severe paranoia. These require evaluation, not a protocol. So here is what I want you to do tonight. With your dinner, 1 tablespoon of extra virgin olive oil, drizzled over whatever you are already eating. That is step 1, starting in the next few hours. Set your sleep time tonight and your wake time tomorrow. Write them down. Same time tomorrow night. Same time the night after. That is step 2, beginning tonight. Tomorrow morning, a 20-minute walk after breakfast and 1 phone call or 1 conversation with someone who matters to you. That is steps 3 and 5 before noon tomorrow. And at your next doctor's appointment, the blood pressure question from step 4, written in your wallet before you go. 5 steps. Under $3 a month in additional cost. Now, I want to be direct about something before you go. If you recognized more than 2 or 3 of the 7 signs in yourself or in someone you love, please do not wait for the next routine appointment. Book a specific visit to discuss what you have noticed. Early evaluation is not a reason to panic. It is a reason to act, and acting early, the research now confirms, is when intervention matters most. Everything in this video is drawn from peer-reviewed research published in JAMA Neurology. The journal Brain from Massachusetts General Hospital and Harvard Medical School, Mayo Clinic Clinical Diagnostic Guidelines, and the Dementia Data Hub 2021 U.S. Prevalence Report. All source links are in the description. This is educational information. It is not personal medical advice. And if you are concerned about any of the signs discussed today, please bring that concern directly to your physician. If this video gave you something worth sharing today, send it to someone in your family who has been dismissing a change they have noticed, in themselves or in someone they love, not for this channel, for them, because the window that exists right now may not stay open indefinitely. That is not a habit. That is your mind, staying yours. Thank you for watching. We will see you in the next one.